the Governor's Council for Overdose Prevention and Pain Management Advisory Council. At this point, I'm Dominic Zerlo, and I'm the chair for the council, and it looks like we do indeed have a quorum, so I will go ahead and read off the names of the council members who are present. According to what we have here, we are recording this meeting. If a council member is present after I finish doing the roll call, just let me know in the chat that you are here, and I will go ahead and add you. So currently present, I show Phil Feudy, Sharon McCracken, Scott McFall, Darcy Wyatt, Randall Starling, Brandon Warwick, Jennifer Burke, and then myself. Is there anybody who's joined since I had a chance to look? Oh, and I'm sorry, and Liz Lacouture is also on as well. Is there anybody else that I've missed from the council itself? No? Oh, uh, and there is Brandon Taylor, who is also joining and a member of the council. So thank you. There we go. So we'll go ahead and start with our agenda. Let me just share my screen so that everybody can see it at this time. So here is our current agenda. So this is just our review, and then we will do a quick review as far as on the minutes. And council membership, I'll just say right now, has not changed since our previous meeting. And then we'll have a presentation on the current data by some of our colleagues over at the Department of Health Center for Health Protection. And then we'll talk a little bit about the legislative session and updates and reminders, and then we'll go into our subcommittee updates, and then other business, and then the next meeting. And so as we sort of had discussed a little bit, or I had brought up as a way for reviewing the minutes, is the request was really that individuals read through the minutes in advance of the meeting. And what we'll just do is during this time, just if there are any changes to the minutes, we can go ahead and make them at that time. And if not, I will just ask for the minutes to be passed. So I'll give people a minute or so to go ahead and read through the brief introduction. We do utilize the recordings as well, which are on the website, the overdose prevention website. And so we do utilize those. So the minutes are really just highlights and bullets based upon the previous agenda. Are there any changes or notes that need to be made? And again, I'll give people a minute with me not talking. So if you haven't had a chance, you can read through what I have on the screen.
Hey, Dominic, I noticed that there's not a date like at the top. It just says meeting agenda and draft minutes from Friday, October 24th.
Oh, gotcha. Thank you, Jennifer. I can get that added on in.
Okay,
That's
thanks.
easy enough. Okay, anything else? And then any objections to adopting these with the change of adding the date at the very top, as Jennifer suggested? No, then by acclamation, do I have an approval? I see heads nodding, some thumbs up, some yeses. I will take that as there are no nays, that we are accepting that, the minutes, and I will make sure that that change occurs on there as far as adding the date back in. That just was me in editing. I must have deleted it. So, okay. And then the next status, as I mentioned, we haven't had any changes in our council membership since our last meeting. We do have a couple of vacancies that we are waiting for the governor's office to fill, but until such a time as they fill those, they'll remain vacant. And so our next item actually is Kathryn. We have Kathryn from our New Mexico Department of Health Center for Health Protection, Injury and Behavioral Health, Behavioral Epidemiology Bureau, and some of our colleagues are going to provide us with some update on the data. Kathryn, I know I saw you a minute ago. Oh, there you are. Sorry, I almost lost your picture here in the number of people here, but are you ready? Do you need me to, you should have control.
Okay, I was going to suggest that Haley Peterson from the Substance
Oh,
Use Epidemiology section, as I'm sure many people saw, the Department of Health has finalized 2023 overdose death data, and I know there are questions about that. And Haley and the SUS team uh, moved mountains to get a few slides approved in time for this meeting. And after that, I will be talking about our drug issues in New Mexico survey 2019 through 2024. But the work that Haley's going to present is some important context for that as well.
absolutely. Thank you, Kathryn. And so Haley, welcome.
Yeah,
And I see you've already put your slides on up, so go right on ahead when you are ready.
yeah. So this is just a very brief slide set, and I'm part of the substance use epidemiology section here. Our section manager Luigi is currently out of town, just so everyone's aware, but he'll be back in about a week and a half. And so Melinda, our overdose mortality epi, was able to get these slides together really quick. I also put a link for the press release in the chat. So that went out, I believe, on Monday and just has some additional numbers, but here's just some brief trendline graphs to share. So as you can see, our drug overdose death rates, have been increasing for a long time, but we finally have some more good news to report that we saw another decrease in 2023 in our final overdose mortality data. So we peaked in 2021 here, and now we're at 46.3 deaths per 100,000 population. So that was some good news that we're starting to see some decreases there. There is a note that the US data is still provisional for 2023. Excuse me. So just to note that that US rate could change. And then we also have the data by county to share, because I know that that's often of interest to our partners. So the purple bars here are going to be the death counts. So, we do typically see the highest counts in Bernalillo County. It is our most populous county, so that's not necessarily surprising. But by rate, Rio Arriba is still the number one county for overdose death rate, and this is an age-adjusted rate for 2023. And then lastly, I'll show the data by substance. So this is from 2019 to 2023. We have any opioid involvement is this top line here. We can see that really the increases we were seeing were primarily driven by fentanyl, also by methamphetamine. In 2023, fentanyl was still involved in 65% of overdose deaths, and methamphetamine was involved in just over half. So there is crossover, of course, because there is polysubstance use. But we also are still seeing heroin coming down, though I have heard reports from some community partners that say that they've started to see, hear more about heroin popping up recently. So, some of these trends could change in future data, but this is what it looks like right now in the final 2023 data. So that's all I had to share for now, but please let us know if any other questions come up. I'm sure there will be some. And we are working on getting more slides and everything put together. It just takes some time.
Great. Thank you, Haley. This is very helpful. Before we move to Kathryn's presentation, are there questions for Haley or about the slides? I know this is really important data for everybody.
Did you share these slides by chance?
They can be shared with the council. They weren't shared prior to the meeting because we we got them
Okay.
approved like literally, I don't know, 40 minutes ago. So
I'd love to spend a little more time, especially in the county level data. And I may have more questions after my brain wraps around it, but would love to have that to ponder.
yeah, definitely. Thanks.
Thank you.
Yeah, Haley, you did send them to me shortly before the meeting, so I'll send them out to the group, the Google group. That way people will have access to them.
Thanks, Dominic.
Okay, and Kathryn, here come your slides. There we go.
Sorry, I was dutifully muted, so I didn't make any noises to interrupt Haley's presentation and got switched around. So I'm following on the substance use epi section surveillance data update. This is an update from a survey that we've been doing annually for a while and reporting on this council.
Kathryn, you accidentally are muted again, I think.
All right, how
Oh,
about now?
there you go. Perfect.
Excellent. This is a survey we've been doing with our CDC funding. It seeks to complement some of the national surveillance surveys that get done in New Mexico, like behavioral risk factor surveillance system survey or the National Survey on Drug Use and Health. We did design it to use some questions from national surveys that we thought we wanted to have a New Mexico perspective on. Every year, we have at least 1,600 adult New Mexicans respond, and we really appreciate our partners in research and polling and all of their efforts to get a really representative sample of New Mexicans to respond. It is, I realize I left this off the slide, but it is both a cell phone and landline survey. And this is just a brief acknowledgement that although we wouldn't be able to do this survey without the federal dollars, that nothing I say should be assumed to be an official position of CDC or the HHS. So as I said, research and polling works really hard to get a representative sample. There's a more comprehensive breakdown of demographics, but I just wanted to show you these are some of the top two categories in each of our areas: Hispanic Anglo balance, and then educational or professional attainment, age. Age was a really nice stratification. This year, especially, I know we've seen a lot in the paper recently about the expectation demographically that New Mexico is going to be a majority elders state within a decade or so. But here we are hearing from, again, a representative sample ages 18 to 34, 50 to 64. The other two categories there, it's all very well balanced. So it's not all folks in their retirement phase. We are hearing from a lot of adult New Mexicans in those younger age groups. Similarly, household income was well balanced. Among those employed, I just wanted again to highlight these are some categories we use. We can't really stratify or look at data because we're still only talking about 1,600 people. We can't really drill down and say a lot within these categories, but we like research and polling's help in capturing them, just so that we know we're not only hearing from people who work in healthcare or only hearing from people who work. So again, construction is well represented, as is hospitality and food service, which we know are key employment areas for our state. I will just mention oil and gas was just under 5% of respondents who were currently employed. And then, of course, we do also hear from retirees, disabled persons, homemakers, and full-time students. And I guess I should acknowledge that disability and also working should not be mutually exclusive categories. So this first section, I'm just going to walk through a few slides about regional variation. That is a level that we can kind of pull out see some differences. I think a lot of folks are very familiar with the Department of Health's public health regions, but just in case you're not, Metro is really the Albuquerque area. Then the Northeast is a lot of counties, but a lot of our very small population rural counties like Harding and yes, like Harding or Union. The Northwest, again, large geographically, smaller number of counties, the Southeast and Southwest. So These next couple of slides are all using a heat map approach. So the highest percentages are going to be in that dark purple, and then shading down into orange, and anything that's a light yellow has the smallest percentages responding. So these are just key substances. This is asking people if they consider use or misuse of these substances a serious health problem for people here in New Mexico. And no surprise, I mean, over half of the people everywhere consider all of these to be an issue. Fentanyl misuse, of course, is something that a lot of people we know are very highly concerned about, with good reason. Methamphetamine, we can see some regional variation here, and also with alcohol misuse, where again, you'll see the highest concentration of people who said, yes, this is of great concern, is in the Northwest region. But again, the margin of error in this survey is plus or minus 2.4 percentage points. So anything that's more than 5% apart may not be a real difference. It may just be because we are interviewing 1,600 people and not every adult New Mexican. But again, I will also be looking at some trend data, which will show some differences year to year, but we can see the heroin concerns, which were mentioned, people more often reporting that as a serious concern in the metro area in the last year. So similarly, this question asks, kind of what is, in your opinion, the most of these options, the most serious problem, and as reflected in the surveillance data, most of, as Haley said, as Melinda has tracked, polysubstances most often polysubstance when we have an overdose fatality here in New Mexico. And this is something that people are aware of. There is still, again, in the Northwest, higher concern than perhaps in the state overall, specifically about alcohol. We can also see some slight variations around methamphetamine, but overall polysubstance use, and specifically a combination of different substances and alcohol. So this is a question, again, I will also return to with the trend data, but this question asks, and this was based on a national question that we've used for a long time now, asking what should the government be focusing their attention on? And drug rehabilitation and treatment continues to be the thing that people most often respond should be the government focus, but criminal penalties, again, is consistently up there. Treatment, as you can see from that purple cell, is really is higher in the Northeast, and criminal penalties are higher than the state average in the Southeast. This is not a response that the interview callers give people, but often a large number of people say both. And again, you can see some regional differences there. And then there are other people who go with depends. And there are a few non-respondents. Now, they do also ask for a reason as a follow-up question. And you can see some of the top reasons, kind of the categories of top reasons. And I don't think it's a surprise to anybody in this meeting that their New Mexican adults are split on whether criminal penalties are or are not something that government should be supporting. So as I said, the next couple of slides are going to look at some change over time, and these are some places where we've seen changes over time in the responses to questions. We've seen some changes in the substances of concern. We've seen some changes in attitude about whether buying naloxone without a prescription or getting naloxone without prescription is a good idea. We have finally seen some change in the question about where do you know where you would get naloxone if you needed it? There's also sort of the framing concept of substance misuse as illness or personal weakness. And again, we'll be returning to where should government efforts be focused. I will say on that question, we initially followed national surveys and did a little bit of a drill down, sort of federal, state, local, but we decided that those questions were really not giving us a lot of value, and we wanted to have room in the survey to ask other questions. So you'll see a couple of those newer questions at the end. This is the graph over time that in some ways reflects, or the slide that you saw with the substances involved in overdose deaths. The first time that we asked about fentanyl back in early 2020, it was not necessarily on the radar of a broad sampling of New Mexico communities. People who worked in healthcare, people who also reported that they knew someone who had an opioid use, who wrestled with opioid use, were more likely to say they were aware of fentanyl and they were concerned about it. But we've really seen that uptick again as you saw the deaths in which fentanyl was involved really climbed in New Mexico. People's concerns climbed right along with that. And while alcohol and methamphetamine use continue to be the top of this chart consistently, and heroin's moved around a little bit, fentanyl is where we really see, again, a broad representative sample of New Mexico adults concerned about fentanyl. And of course, some of the challenges that people involved in this panel have been obviously working very hard on is how to educate and translate that concern into meaningful measures, and not simply some of the alarming tales that tend to spread quickly. So, trends in change. This is something where we've seen a real change. Back in 2019, the first time we asked this question, more New Mexican adults said no, people shouldn't be able to access naloxone. Again, then said yes. It is now really, really, really those lines, as you can see, have just diverged enormously over the last 5 years. And although I do have the asterisk on the 2024 data because we changed the language of the question a little bit to reflect the different avenues through which naloxone is available now, we know that's changed a lot since 2019. The fact that the numbers are really consistent with what we saw in 2023 before we changed the question, suggests to me that what we are seeing is this real change in the understanding of what naloxone is, and the understanding that it's really an essential part of your first aid toolkit. And I will say, if anyone, the question is asked if people who take the survey, if they are aware of what naloxone is, and if they're not, they get a very brief explanation. I think an interesting question, which I don't have the answer to, is how often the survey callers have had to give that explanation, because my understanding is that back in 2019, they had to explain what naloxone was fairly often in some cases, but that I would certainly be my hope now that is less necessary. So this is the paired question, which says, do you know where you would get naloxone if you needed it? That's deliberately the broadest possible language. And I will just say, when we first shared this data in 2019, that only 40% saying yes, a higher percentage in the Northeast region said yes than in the state as a whole, which is still true. But people said, oh, that must be a blip, that must be a fluke. But as you can see, unfortunately, that 40% rate is really where things stayed until this last year, where we've finally seen those trend lines bend so that they are within the margin of error. So it's basically, it's a wash instead of having a higher number of people saying they don't know where they would get it. Now, again, people who work in healthcare, people who know someone with substance use, people in the Northeast region have always had higher percentages than these. But this is the case of something where the long-term access and education and outreach does seem to have moved this data point at long last. And this, as I mentioned in the overview, is just a quick look at this question about sort of people's frame for substance use. And as you can see, there was a really clear, split back in 2019. And at this point, we've got all of these categories. And again, both is an answer that is not offered. It's presented as a dichotomous choice, but there's always been a number of people who say both. And at this point, all of these categories, I would argue, perhaps reflecting an understanding that that maybe, and I would appreciate members of the council's input on thinking about this question. Is it still a useful question to ask? Is it something that gives us information that can be valuable for broader education outreach? Is it something we need to ask differently? But at this point, what this data suggests to me is that people are not comfortable with those two options. So we're getting a lot more saying kind of the both.
Kathryn, if I may ask, are you asking people that like as an opinion or from like a professional standpoint?
Yeah, well, again, most of the people responding to this survey are not healthcare or professionals. So yeah, this is asking people for their opinion. And this is a framing again that we did borrow from national surveys because we were curious. National surveys, if they survey a couple thousand people, they may only speak to a handful of people in New Mexico. And that's where we really saw this chance to ask. And I see Dominic's hand up. So
Thank you.
Yeah.
Kathryn, I just had the question of, is the question that's asked, is it exactly as it's read on the top of the slide or as it's written?
Yeah.
So it's, but is it prefaced like early in the section where, do you believe that's, does someone addicted, blah, blah, blah. Is there that aspect where it's a little more specific and asking, if it's their opinion or belief?
Yeah, Dominic, I can actually pull, not right at the second, but I can pull up the call script for you because I should just say I'm kind of pulling out highlighted questions. The script as a whole guides people through, and we had asked initially, way back in 2019, there was also a question about was there more stigma again around some kinds of drug use than others? Because we were still focused very highly on prescription opioids at that point, and that's primarily what we were initially funded for. So yeah, I can definitely pull up the script, and you can kind of see where this question flows in. But yeah, I'm not presenting the questions in the order that people would be asked them in the survey, if that helps. And I
It
think
does.
Yeah.
Thank you.
I see another hand up. Is that something we can, I'm not quite sure who EL is. That Liz?
That's
This is
Elizabeth.
This is Liz. Yeah,
Yeah.
I was just curious. This question is specific to illicit drugs. Do you
Yeah.
also ask the question for alcohol?
That
Be curious
is
if there's
another,
any difference in perception.
yeah, that is another interesting funding question. we initially were not allowed to ask about, we were not allowed to use CDC dollars for anything that was alcohol only. So we kind of, since it's doesn't make a lot of sense to talk about substance use and public health and related harms anywhere in the US, but especially not in New Mexico, and not talk about alcohol. So I think that would be a really interesting question to ask. As I said, initially, we had followed national models and we asked about prescription opioids and illicit substances to see if there was a difference. And for most New Mexicans, there really wasn't a difference. But I think our Office of Alcohol Misuse Prevention, Rebecca Neudecker, I know I've shared this slide set with her, and I think we could look at asking specifically about alcohol in the coming year. I'm afraid this year's 2025 survey is already in the field, but we could definitely look at asking that the next time around.
Yeah, I mean, it does seem like there's not a lot of convergence between the two, and illicit and prescription maybe, but I'd be really curious to see if that's different for alcohol.
Yeah.
And Kathryn, Julie has her hand up.
Yeah. Hi, Julie.
Hi, I'm trying to unmute myself. Yeah, just a quick thought. I was wondering, and I know you're using the wording of this, you're not exactly sure yet exactly how it's written, but I also wonder if it might be better two separate questions. Because I think of myself and I think, yeah, I have a personal weakness and I also might have an illness, right? For various things. So I wonder if asking, like, do you understand addiction, as as an illness or a complex illness, yes or no, and then a separate thing about something about getting into the issue of personal weakness. I just wonder if people kind of are understanding them and wondering if you're asking, like, one is, you know what I mean? I don't know. It's hard to tease those out. Sometimes it might be worth asking it separately.
I agree, and I'm really glad you asked that question, Julie, because there are kind of two things. This survey, unlike the behavioral risk factor surveillance system and unlike a national survey on drug use and health, deliberately does not ask about personal use. We're asking for your perception of your community, people the state as a whole, but also the language question, because we've thought a lot about maintaining some of the language, saying addicted versus other things other formulations we could use. And we've kept some of that language, partly to be able to look at how responses to these questions change over time, and partly for comprehension levels. But I agree. And what kind of the language people still more commonly hear and use. But there was a separate, specifically stigma survey that looked a lot at language that we did in 2022 that Jamie Davis really led. And there's some really great work with stigma assessment in communities that our overdose prevention section is doing with community partners this spring. And I think both of those are going to be really, really valuable.
Thank you.
I had a question. This is Brandon Taylor. This data is really interesting. And one of the facts that I'm aware of from a lot of data for many studies for, I think, decades now, that probably everyone else is as well, is that trauma and surviving trauma is one of the most major cofactors for developing a substance use disorder. And that I believe some of the studies show something like 20 to 30 times more likely to develop a substance use disorder if one is a survivor of trauma. And that trauma being, a range of anything from violence, abuse, neglect, family or social conflict, etc., death of a loved one and whatnot, whether it's in childhood, of course, adverse childhood events, but even in adulthood as well. do any of the questions nationally or here in New Mexico ask anything about people's understanding of trauma or its relationship with addiction or substance use or abuse?
Well, the behavioral risk factor surveillance system data, because yeah, we know that that walks hand in hand. Higher numbers of New Mexicans who've experienced adverse childhood experiences, have experienced other kinds of trauma, sexual violence, and other kinds of trauma. That's one of the things that my colleagues in the Injury and Behavioral Epidemiology Bureau, our Office of Injury and Violence Prevention, including sexual violence prevention and suicide prevention,
Mhm.
that's absolutely part of the picture here, for sure.
I thought adding
Yeah.
in or having something, I understand why the desire to parrot national data questions and so forth. I just thought including in somewhere a personal trauma or surviving a personal trauma in these kinds of questions might be helpful, just to see people's understanding of what that sometimes substance use or abuse is an coping mechanism or a self-medication for trauma. And I think many people can kind of empathize and understand and relate to people suffering from something like that, as opposed to a personal weakness, a personal trauma, or surviving a personal trauma. Just thought that might be useful or interesting to consider, and the
Yeah.
addition of.
And some of the questions in the stigma survey from 2022 that I talked about are framed that way. And in fact,
Right.
when we did the stigma survey, there was there were resources offered to people participating the same way that callers who participate, people who are called for the behavioral risk factor surveillance system, get asked about very sensitive topics that, of course, the interviewer does not want to increase their trauma, but, wants to give them space and resources. This survey, again, deliberately does not ask a question about you personally,
Oh no, I know.
because
I know
it's
it
trying
doesn't.
to, yeah.
I
So,
was wondering if it
but
would under,
yes, there are
I was wondering if it would
absolutely,
gauge population concepts and understandings
yeah.
of people's reaction to trauma, both healthy or adaptive or functional, dysfunctional responses, and trying to adapt and cope with trauma. That's all. I understand who
Yeah.
the target audience is, the general population, and their opinions and understandings. Thank you. I really appreciate the stigma study reference. That's really helpful to know about as well.
Yeah, and I will be happy to connect anybody I can with my colleagues in injury and violence prevention who are really our experts on that. And of course, so many other nonprofits around New Mexico and community groups that work in these areas. All right, so as promised, there is also a trend on the what should government focus more on. And as we saw in 2024, the answer was still more than twice as many people said rehab and treatment. The thing that I just wanted to make the council aware of in this data is that that's actually dropped since we started asking this question. And the criminal penalties, and again, both have inched their way up. So this is just a little context. And I think, again, people are seeing and hearing this certainly in some of the debates in front of the legislature last year and this year and going forward, that there's still a lot more New Mexican adults say rehab and treatment is really the more appropriate focus. But again, that this is something that has shifted from 2019. And I'm sure people have a lot of experience with that, and probably some thoughts about why we're seeing this change. So to wrap up, just some untrends, things that really haven't changed. For those of you who've heard me present on some of this data in the past, this first bullet is the data point that New Mexico Department of Health Communications usually pulls out and uses for a press release, which is consistently adult New Mexicans say they know someone who's been 3 out of 5 say they know someone who's been dependent on or addicted we offer both those language choices to opioids. Something else that really has not moved is the number of adult New Mexicans who say they are aware of someone, that could be a colleague, a family member, a friend, who's been treated poorly by medical professionals due to their substance use. And so that's another piece of the stigma puzzle. We do also ask about media campaigns because one of the ways that we've used the survey at DOH is for evaluation and program planning. And so we have asked about media campaigns. Often people say, yes, I know I've heard someone thing, but they don't recall a lot of specifics. We then provide them with some taglines. And so quite often CDC has had some campaigns. The DEA's campaign, Wake Up New Mexico, Get Smart About Drugs, tends to hit there. And of course, our colleagues doing a dose of reality. The awareness of alternative pain management techniques, medications, or treatments has also stayed pretty consistent over the years. People always mention cannabis, acupuncture, and over-the-counter pain meds. And then some of the other things that are always mentioned are chiropractic, exercise, massage, and meditation and mindfulness. So these are a couple of the new questions that have just been asked for the last couple of years. And the first one, can most people with alcohol or drug problems access the services they need in New Mexico? And this is another example of a New Mexico specific question. This survey continues to be changes every year. We try to be responsive without making it unbearably long. So we continue to have a hybrid of national questions and state level questions developed here. And this seems to be moving in a good direction. Obviously, we would like the yeses to be a strong majority, but it's not clear at the moment. These are all still, the differences between 2023 and 24 are still within the margin of error for the survey. And then the other question that we had started asking was what kind of person or group people would like to receive help from. And these are unaided responses. So this is what somebody says without being prompted. It's a phone survey, so people aren't looking at a list of options. And so primary care, inpatient, outpatient, community support, therapy, religious leader, and family. And then there's the not inconsiderable number of people who say they don't know. So this is a question that these two questions are ones that we really hope to make more use of. And of course, there's been a lot of effort with the New Mexico Opioid Hub and provider education offered through a variety of means to make those primary care healthcare providers more comfortable, more willing, more prepared to support their patients, including any issues their patients might have with substance use. And of course, a lot of work done around alcohol screening, brief intervention, referral to treatment. And again, this really, really supports that approach, that is the first thing that more New Mexican adults say is that I would really like to be able to get. I really think people should be able to get that kind of treatment from primary care, from their clinic. So I know I've taken extra time, but I appreciate the questions that were asked while we were going along. And of course, if you think of additional questions, these slides have been cleared to share, so I'm happy to share them. And there are a lot of questions in the survey that I did not talk about today. And I'm happy to answer questions about those if you want to reach out to me after the meeting.
Thank you, Kathryn. I think we have time to take one or two questions at this point, and then we do need to move on just to make sure that we're able to get through the rest of the agenda. But are there any pressing questions for Kathryn at this moment? Okay, well, if not, I know Kathryn will be here for a little bit. So, if other questions come on up, you can put them in chat. And even if we're not able to answer them here during the meeting, we can make sure that you get an answer here shortly. So, okay. Thank you, everybody. And very nice positive responses in the chat on this. So thank you. All right, so our next item is actually legislative session and some updates and reminders. And my portion is really about reminders because this comes up every year where people have questions about what they can and cannot do if they go to the roundhouse and they're at committee meetings or anything with regard to the legislative session. So Department of Health employees and HCA employees, state agencies basically are very aware that we cannot go to the roundhouse and speak on bills unless we are specifically invited to do so. And so we do not. Now, of course, individuals can do it in their private time and on their own, but if they're a state employee, they actually have to make sure and let people know that that they are doing so and record down that they are taking time off. Now, for council members, it is a little bit different. But do remember that as a member of this council, you can't speak on behalf of the council. And the main reason for that is because this is a governor's advisory council. And so the recommendations and things that we do actually go to the governor's office. So we cannot, as members of the council, directly support or advocate for specific pieces of legislation, especially if it's regarding funding. However, again, you can on your own. So for example, if Phil wanted to go and speak on Bill XXX, he can go as long as he's being very clear that he's saying, my name is Phil Feudy. As a citizen of New Mexico, I am here to speak on Bill XXX and sort of to move forward on there. Now, that does not mean that you cannot share information. And in the Google group, and I brought Phil up on this because Phil often is one of the people who's sending items to the Google groups with regard to legislation that's coming on up. So you can actually share if there are bills or specific items that are coming up or hearings, things like that. You are welcome to share those. That is not a problem. And of course, any agencies or nonprofits or other agencies, if you are representing them at the legislature, you can of course do all of that. That does not affect with regard to this. You just can't say, well, I speak on behalf of or as a member of the Governor's Advisory Council. So just be aware of that. The main reason we do that is there have been people in the past who, not thinking about it, have mentioned that or have been asked that. And then what they say, oh, yes, I'm a member of that council. And a legislator has said, oh, so the council is in agreement with this. So when things like that occur, just make sure to say, I'm speaking on my own behalf, not on behalf of the council. And then you're fine. And that works. And I will say that I can encourage people to attend sessions at the Roundhouse, to attend hearings, especially as they come up on different items. And of course, go out and do what you all do best, which is advocate for the people of New Mexico. So does that all make sense? Questions on it? Yeah, and again, the reason I say it is because we have in the past had just a few people who've unfortunately fallen into the trap when they've been asked questions and kind of gotten a little bit in trouble, a little down the road. Mostly that's been various staff members at different points within agencies, but it has happened with some of the other councils. I don't think it's actually happened with this one, but at least not to my knowledge. And with that, I am going to open the floor on up to see about if there are any specific bills or items people are aware of. But before I do, we actually have Josh Swatek is also on the call. And he has moved into a new position within our policy and comms division here at Department of Health. And one of his main jobs is actually as one of our primary liaisons with the legislature. And so, Josh, is there anything else that I might have missed or anything we should be cognizant of with the upcoming session?
Thanks, Dominic, and hey everyone. No, nothing that you missed as far as legislative protocol or anything like that. I just hope everyone has a good legislative session. It's going to be a whirlwind. We're coming up on the 60-day session, so there's going to be a lot of stuff that's out there. So I know quite a few of you are advocates in your own personal capacity. So I wish you the best of luck, and I hope you all have fun. And I'm sure I will see a number of you at the Roundhouse at some point or another. And if you see me and I'm not sitting with the governor's office or talking to a legislator, or hurriedly running through the corridors, stop me and say hi. Hi, everyone. Thanks, everyone.
Okay, thank you, Josh. And so at this point, I'd like to open it on up. If there's any potential legislation that may be coming up that anyone's aware of that you might want to share as far as with other individuals, I'll open the floor for that.
I just wanted to ask, do we know what the governor's opinion is on the advisory council's recommendation regarding acupuncture and Medicaid? Because I've just never heard anything, and I expected that the governor's proposed budget or that from the legislature would include funding. I think that HSD, as we talked about in our last meeting, stated it would only take $7 million for the state's input to be able to provide acupuncture to all Medicaid enrollees. There are about 900,000, is my understanding at the last count, around 40% of New Mexicans that are enrolled that have no access whatsoever to natural pain relief from acupuncture, which is a primary care modality in New Mexico. And I'm just trying to figure out, since that's less than 1% of the budget of the state budget for Medicaid, and since HSD proposed it themselves last year in the 30-day session, what's exactly happening with that?
Sure. So Brandon, what I can say is, like, for example, for the council's recommendation, the budget is really determined in September and October as far as for the presenting. And so even though we have that recommendation and we did forward it on, it wouldn't have impacted this, but we will see what happens during the session. As you know, a lot of things change during the session itself, especially with regard to budget. Yeah. And then somebody else had their hand up and I just saw it go
So
down. Did they
can I
still
just
want
follow
to?
up really fast just to make sure I was clear?
Absolutely.
We recommended it last year as well,
Yes.
and it also was an HSD proposal. That's why I was just trying to understand if
Sure.
there was any traction at all or not. And
Yeah.
that's just what I'm kind of curious about, since it's a multi-year process that's happened for several consecutive years.
Sure. And I unfortunately don't have any updates with regard to that. Yeah. I'd like to say that yes, this is what we get told every time, but unfortunately, as you know, that's not really quite how it all works. But Michael.
Yeah, I was just going to expand on that. Actually, this group made that recommendation in 2012 for the first time. So that's been 13 years. It was a different governor. We worked on it together. Thank you for doing your presentation last time. When the chiropractic community worked on it, they created a workforce group that took about a year and a half to work through. And that is probably advisable to go through, to kind of request them to do that work group.
Yeah, and I think the unique thing was that HSD had actually proposed it in their own budget the last go round before it became the healthcare authority. That's why
Nice.
it was, the calls were coming from inside the building. HSD actually reached out to DOMs and others saying, we need you desperately because we have, as we're all aware, a shortage of primary care providers and pain management treatment in our state. And it also takes a long time to get in with an OT or PT in the Medicaid program. If one's not in an acute care facility, there's just a little access. So I just was wondering if anyone had heard whether the governor had included that in her budget or whether that was something that was gaining traction at all or not.
And actually, Brandon, Charles just posted some information and he has his hand up. So let me turn it over to him. Charles, go ahead.
Thank you. Yeah, just letting you all know, I don't know, about a year or so ago, I started participating occasionally in these meetings, and because I'm working with a group that is proposing a preventative program, state level, for using some of the money from the recovery fund, $3 million per year for 3 years for upstream program. I put in some details about it, but happy to take any questions. Want to make sure you all who have these responsibilities and the agencies and all know about it and can start thinking about it. Some of you probably have to write analyses or what have you. So just take any questions if anybody has any.
So I do see, Liz, you have your hand up. Was it a question for Charles or something else?
No, just a question back on Brandon's discussion about acupuncture coverage. Do we know what other states are doing in Medicaid? Do we have a CMS position on coverage of acupuncture? Because that could be influencing the state's position on coverage or attempt to include in the waiver.
Oh, yeah. There are 14 other states that cover acupuncture right now through a waiver program with Medicaid, and the state is convinced of the data already. That's why HSD proposed it in their own budget. And my understanding is that basically it just didn't happen. The governor didn't include it in the budget last time, and then the state legislature did not as well. But the data was already found to be convincing, and HSD had proposed it themselves in their own budget for the waiver.
Thanks.
Okay. Michael?
One of the bills that we're going to be working on kind of leads up to that. That we're working on advanced practice. So we already have advanced practice chiropractors that do more procedures such as trigger point injections, prolotherapy, some limited pharmacology, muscle relaxers, and different things for pain management. And this year, we're going to be reintroducing a bill to increase the scope of practice to include plenary licensure to help with the primary care shortfall. And I've put together a presentation about that, but we will be presenting that, and we're looking at clerkships, internships, and ultimately residencies in universities and federally qualified health centers. So I'll thank you for letting me talk about that.
Josh, go ahead.
Josh, you're next.
Sure. So I just want to provide a very, very, very brief overview of the budget process and why sometimes you'll see agency proposals not make it into the executive proposal. So what your agency proposals are, those are basically wish lists that go up to the governor's office, and the governor's office has the pretty big responsibility and difficult responsibility of whittling that down to what is actually going to get spent. The wish list always is much, much more than we have in funds available, and way more than the LFC is willing to spend. So what the governor does is the governor's office whittles that down to the top priorities and the top legislative priorities every session. So even if it's in an agency budget, it's something that we would like. It doesn't always make it into the executive or the LFC budget because of that very reason. We'd love to have it, but budgets aren't unlimited, unfortunately. So I just wanted to let folks know that that's kind of what that process looks like, and why you sometimes see that discrepancy.
That's really
Josh.
helpful. And Josh, since you chimed in, which I really appreciate, I just wanted to share in response, since I had started that thread, is that the reason why HSD had proposed that in their budget was not just a wish list, but was actually to save money in other places, because every time that the state pays a few $100s for a series of acupuncture, well, because they only pay 20% of the cost of, the Medicaid program for any services that are rendered. Every time the state pays a few $100s to avoid $10,000 to $50,000 in a back surgery or in acute emergency room visits and so forth for Medicaid enrollees, the big picture was to spend a little bit to save a lot. That's just something I wanted to share with you, since I suppose, know a little more about what happens on behind the scenes, to make sure that that wasn't forgotten. So thank you so much for chiming in. I really appreciate your work.
Yeah. Thank you, Brandon, and thank you, Josh, for having that brief explanation. That might be something that we should consider for a little bit, maybe at the next meeting, of doing a little bit more of a discussion about how exactly that budget process works, so that we can do that either in the next meeting or maybe the meeting after that. So, okay. Any other questions or items to bring up at this time about legislative session? No? Okay. Well, again, everybody, you can utilize the Google Groups. It's a great way to get some of the information on across, and especially to the people here on this particular council. So with that, we'll move to the next item, which are the subcommittee updates. And Phil, you are up first with emerging trends.
Hi, everyone. We as a committee have not met since the last meeting, and we don't have anything heading into this session. But a few updates on the adulterant checking program in general and what we're seeing around the state. Since we met last, the second two pilot programs have launched, and so we now have the first two programs with the Mountain Center in Espanola, New Mexico Harm Reduction Collaborative in Albuquerque. We've added Alianza in Roswell, and our experiment with trying to incorporate this into public health office setting is right here in Las Cruces. And so that little machine behind me is one of the ones that we're using. All of that has been going pretty smoothly. I think it's been a few things to look forward to. I've been really pleased that there has been so much interest in this, and it sort of reflects the way that this, as an intervention, has been embraced around the country for being relatively new, 2018, 2019. So we're really on the front end of that. But it has turned out, of course, not to be particularly straightforward. And the information that we are collecting and looking at is really complicated. And so been working on ways to make that a little easier and a little more accessible for everybody who can potentially use the information. We are currently pretty close to being able to launch accessible data dashboard that will be hosted on the nmharmreduction.org website, along with the other resources there. It'll have some nice visual representations and the ability to pull down generate some reports. So if you're looking for just information from a particular time or from just one of the regionally specific programs, you should be able to do that. And so that I've been working closely with folks from the drug checking program in Toronto, and they are helping. They have a really nice dashboard that I sought to emulate, and they've been very gracious and are working with us to be able to input data in the way that we're collecting it. I think we also have hit a point, nationally where all of the hundreds and hundreds of things that we've been able to see now turning up in the supply, all the various adulterants and chemicals and precursors and intermediaries and all the rest of that are kind of got to a place where we know what most of them are. And so I've been able to put together a standardized data collection forum for the programs to use, complete with drop-down boxes and everything. And so that and those sheets will will live feed the data dashboard. So that particular data set should be available within a few weeks of whenever somebody chooses to look at it. So along with that, then there will be a page that is a dictionary of all of these things and things that are known to have some psychoactive effects and some that are not. So again, really, it's really great. It seems that there was a vacuum for this kind of information in decision making and intervention, and just honing in on a way to make it the most useful to the most people is what we've been working on. We're starting to see an uptick in some samples that are, there seems to be more fentanyl coming back after it almost disappearing. Summer, we're waiting for some more recent results to come back, but we've also been hearing stories of some behavioral issues as a result of it. People's tolerances and things have lowered over the summer, and so seeing some of that and hearing some reports of overdoses, increase in overdoses and requests for naloxone happening. Also have seen a bit of heroin showing back up again, and at least initially, most of that was just heroin and things related to heroin, but very quickly we kind of saw all of the other things that we were contaminants and things that we were seeing in the fentanyl also showing up sometimes with the heroin. Methamphetamine is still just methamphetamine. The cocaine and crack seems to be just cocaine and crack. So our stuff it's really been the opioid supply that's been problematic. So hopefully when we meet again, we'll be able to display the dashboard and go that way. And then once that information is there, I'll probably want to pull together a group of people who at that time can help figure out how we can present that information in a way that's most useful to everybody. So.
Great. Thank you, Phil. And that would be great if we could have a small little presentation on what's on the dashboard for the next meeting. So I've put that on our agenda for the next meeting.
Cool. Well, I've also got it's technically 2 years worth of data since the Mountain Center and NMHRC and a few other folks around the state. As soon as the regulations were promulgated for House Bill 52 in October of 2022, began taking advantage of the mail-in service from University of North Carolina. And so I've managed to put that together with our first year's worth of data from the 2 programs, and have just about got all of that compiled. And I'll be running some reports off of that pretty soon that will be shared as well. So.
Okay. Thank you, Phil. That sounds great. So I'll put you on down for a little extended time within the emerging trends specifically for those 2 items. Does that sound good? Any objections? Nope. Okay. Sounds good. All right. So next, Buprenorphine Access Committee, Cotton.
Yeah, so I have sort of 2 different things. We did convene since the last OPPM meeting, and we met with some folks from SAM who are the adult substance, I believe they're still calling it substance abuse and mental health group, who they are introducing or kicking around the idea of introducing something that would mandate pharmacies have the extant number of prescriptions like +2, and that's legislation that's based on some San Francisco, some legislation that was just introduced and passed in the city of San Francisco that seems to be going well. So they were kicking around that idea. We met with them and talked about it briefly, but that's about it. And then the other update I had for you all was just around the study the NMSU conducted and the results, which are now available. And so I figured, I do see like we're running a little late on time, Dominic. So I don't know if you want me to like present about that now or like put that as an agenda item for next meeting.
Cotton, why don't you give us the top 3 items, like in a bullet point if you can, or 2, whatever.
Yeah, yeah.
And then what we'll do is I'll add that for the next one as well.
Okay, yeah, no problem. So yeah, so for those of you who don't know, we did a survey partnering with NMSU that was modeled on the Weiner survey, which was a nationwide study on buprenorphine availability. We surveyed every pharmacy in New Mexico, and what we primarily did was run straight headfirst into the barrier of pharmacies not really wanting to respond to the survey, right? So a formalized survey is not really, I think, going to generate the data that we need, because folks are reticent to answer when they don't have buprenorphine in stock to a formal survey. And so Jessica Carr and I have gone ahead and designed a secret shopper study that we'll be trying to roll out in February to answer the problems with this study. But unfortunately, I don't think we're going to be done with it. Well, obviously not in time for this year's legislative session. So yeah, just a lot of lessons there to be learned for sure. And that's about it. So thanks for your time, everybody.
Thank you, Cotton. And I mean, as much as I'm not all that surprised by that barrier, I'm disappointed by it, but not in you all and the efforts, just in knowing that that actually happens and people aren't willing to share information, because it would really be helpful for us to be able to figure out how do we help improve that situation.
Mm-hmm.
So, Phil?
I just wanted to add that, the NMSAM folks kicking around the idea of emulating San Francisco's legislation, simultaneous to that. Also, Martin Heinrich and another member of Congress have got a bill submitted, also doing something similar in getting the DEA. I believe it's getting the not getting buprenorphine removed from the MMEs and all that stuff that are right now. It's being lumped together with other opioids, and that's one of the problems that's preventing access. And so they're looking to break that out so that we don't keep running into this problem. So there's multiple things happening simultaneous with that, which is pretty great.
Okay, great. Thank you, Phil. Okay, anything else, Cotton, or from that group?
Not presently. I'll keep you posted.
Okay, sounds good. Okay, and then Michael for integrative pain management.
Yes, and thank you again to Dr. Taylor for presenting last time. That was great to watch. And we haven't had an official meeting. Typically, it's out of the people that are here, it's going to be Brandon, the Godfather, Dr. Ryan, and Darcy Wyatt's, I believe, on here. But we've had some email exchanges, and in October, I gave a presentation with some colleagues to the Legislative Health and Human Services Committee about the bill that we're working on. In November, I was actually appointed as a clinical assistant professor at the UNM School of Medicine, and I've been working with the leadership there and trying to work towards integrating more traditional chiropractic manipulation and other things into the university. And then I had put together a big, huge PowerPoint, or not PowerPoint, but a presentation about some of the background information about all of the professions that have expanded their scope of practice to include various procedures for pain management. And I was trying to work on a presentation or a recommendation, but it sounds like we're going to need to shop it a little bit offline. And I'd love to get together with Brandon and Dr. Ryan, Darcy, anybody else that would like to be part of the committee. And then next, about a week and a half, I go out to Washington, to DC for, I think, the 14th time to work on our Medicare Modernization Act. And I found that this was a big part of the reason that our Medicaid program in New Mexico hasn't been as robust as we had liked, is because it's kind of limited by the Medicare model. So I'll go ahead and share this background information about some of the questions that the Legislative Health and Human Services Committee members had about our presentation. Was about credentialing, about general education of the various professions and how much time it takes to be able to increase the scope of practice. But do you have anything to add, Brandon? If you have anything that...
This is a late meeting, and I have a lot of thoughts that I think we probably should have together in a committee meeting. I mean, I think one of the challenges is that I empathize deeply with the need for more primary care, obviously, and that this is something very important for our state. I also, there's so many different aspects of why this is happening. I mean, even I can think about how many people are becoming NPs and MDs who are never practicing what we consider medicine because they're spending most of their time injecting aesthetic products into people's bodies and or doing functional medicine, which I believe is a real thing. Obviously, I offer functional medicine and believe in functional medicine, but it seems to be so often about, doing concierge practices and having really high cost vitamins and very high cost visits for very limited services. And this is part of the brain drain that's happening, I think, is that insurance companies are under reimbursing providers. We know that primary care practices go out of business constantly. I don't know how many per day or per minute in the nation go out of practice because it's very hard for primary care practitioners to make it in small family practice environments. And most DOMs and DCs own their own smaller practices. They keep getting conglomeratized into corporate medicine. And the workload of most primary care providers is so high that many people leave the field or go into other fields. And so I'm really grateful that we're considering and thinking together individually and as in our professions and collectively about how to solve these problems, because they're very massive and they're affecting our well-being as a state. And that's very serious. I think part of what has made it so relatively easy for nurses to become nurse practitioners, relatively easy meaning, a program of a few years and whatnot, is that they're already so completely integrated into the modern healthcare system and have already been involved in prescribing medications and seeing reactions and understanding dosages and administering those medications. And a lot of modern primary care is very pharmacy related. And of course, also, referring to specialists and referring to labs and making sure that people are getting their regular checks for their tissues and getting their histology done and their right time to have their mammogram and on and on. I guess to summarize, because I'm trying to do this as quickly as I can, What concerns me is if a DC or DOM becomes a primary care provider in terms of the current context. We already know that DCs and DOMs are primary care providers in the state of New Mexico by state law, because we don't have to have a gateway or a referral for people to access our care or for insurance to cover our services, thankfully. However, to be what we consider the common modern medicine primary care, which we work with primary care providers like NPs and NDs at my clinics in Mountain Spirit, we would have to have a lot of training and experience in medication management, because we're one of only two nations in the world that do direct to consumer pharmaceutical marketing. So there'd be a very high amount of pharmacy education, I believe, that has to happen, and experience that I just seeing the proposal of 90 hours right now for that education, and knowing that that's basically the amount of hours that are, in a lower division, chemistry class. It makes me wonder. I just want to make sure that we're being thoughtful.
We'll definitely have to meet. We'll definitely have to meet, because it's
this is what I saw in
close.
the proposal, the bill that was proposed. That I just read was 90 hours of pharmacy. I just think that it's something that really has to be thought of very mindfully to make sure that we first do no harm as providers in accessing these services.
Yeah, no, there's going to be a lot more than that in the legislation.
I just got it Monday.
Yeah.
So I'm doing my best.
Okay, well, thank you for your input, and thank you, Dominic, for your input as well.
Absolutely, and thank you, everybody. Anything else from the group, Michael? From the subcommittee?
No, other than if you would like to be part of the subcommittee, please raise your hand now so that I don't let you out. Oh, Christina Walker. Excellent.
Okay. Great. All right. Well, thank you, everybody. So our next agenda item is any other business that we need to discuss today. No, with seeing none. So our next meeting, usually if we follow the same pattern, would be scheduled for Friday, April 11th at 1:30 to 3 o'clock. Any objections to that meeting? Nope.
I'm sorry, what day was it?
It's Friday, April 11th. Any issues or concerns? I'm seeing thumbs up and a few other head nods. Okay, so we will go with that for the next meeting. And then just sort of to review, what I do have right now for items is a little bit of discussion again about budget process. And I'll actually add, we can talk about budget process and recommendations. That way we can talk about how the process goes through the rest of the year. And then some time for Phil with regard to the dashboard for drug checking and that data update. And we'll do that during the emerging trends. And then some time, additional time for Cotton to talk about the survey results and about maybe perhaps not the conclusion of, but maybe a little preliminary information from the secret shopper side. So we'll see what happens on there. Okay, and with that, unless there's anything else, we are concluded for today. So before I announce that the meeting is over, any other items that anyone forgot about or quick announcements? No? All right, everybody. Well, I hope you all continue to have a great beginning to the new year. And as it is legislative session coming up in just a week and a half, I hope everybody has a great legislative session. And again, please feel free to utilize the Google group to send information and updates and potential bills, things like that. And I hope you all have a great couple of months coming on up. We'll see you in April. Thank you, everybody.
Bye, everyone.